We're now joined by Dr. Ramin Hastings, who is medical director of the Structural Heart and Valve Program and an interventional cardiologist at Englewood Health. I do not want to confuse a radiologist with a cardiologist. You are, in fact, you admit that you are a cardiologist, correct?
Yes, I'm a cardiologist, yes.
Before we get into this any deeper, why cardiology?
Yeah, from medical school, I was trying to decide which type of medicine I would want to get into. And I remember kind of this was a last minute change. I did a rotation in cardiology, and I knew right away that it was the field I wanted to go into. And I think what really drove me to cardiology is we have so many therapies that can vastly change people's lives in a matter of seconds, take them from a debilitating disease to almost back to normal and back to their regular lives. And there's just so many areas of cardiology where we can do that. And I knew right away watching those patients that this is where I wanted to be. Certainly was the right decision for me.
Let me ask you this. How has COVID, particularly long COVID, impacted heart health?
For me, the biggest place where it impacted originally was that people were not coming in for their care. And so, the scariest thing for me is we kind of didn't see heart attacks for several months when COVID first arrived. And, we knew that they must still be happening, but just people were so scared to come to the hospital that they weren't coming in. So, a lot of people ended up, not surviving at home. And a lot of that is probably due to COVID, but a lot of that was probably due to not seeking medical care. And now as we get into the longer phases of COVID, I worry that people are still kind of hesitant to come to their physician and get those primary care and preventative care measures that could really help them long term. In terms of long COVID, I mean, we are seeing a lot of patients coming in with long COVID. And a lot of that is thought to be potentially due to some cardiovascular effects. Some
cardiovascular what?
Effects, reduced cardiovascular function. And so we're seeing the whole gamut of it. And, I think we're just scratching the surface at this point. And so as more data comes in, hopefully we'll have a better understanding.
Let me try this. I was telling you before we got on the air that, my cardiologist is part of my life because there's a family history. My grandfather, who I never knew, passed away at 44. My father's younger brother passed away. My dad, who passed a while back, had heart issues. And so the family history issue is always there. I'm always aware of it. But I keep telling myself I can do certain things. It's not about me. It's about anyone because family history comes up a lot. How much can we do in spite of our family history and who smoked and who drank and who did whatever? That's another story. What can we do for ourselves, for our heart health versus men and women versus, hey, listen, that's just your family history. Please, doctor.
I mean, there's so much that we can do. Simple lifestyle changes are obviously the most important. So eating a healthy diet, exercising, not smoking, is extraordinarily important and is the backbone of the therapy of preventive medicine if people have family history. But beyond that, we have so many tools at our disposal to try to help reduce the risk of developing heart disease in patients who are at very high risk. From screening modalities to check for the beginnings of the development of heart disease to, powerful medicine that can help reduce cholesterol to markedly reduce your risk of developing heart disease in the future. We have multiple medications now. Previously, statin therapy was really the only medicine that we had available to us. But as the technology has grown, we now have a whole, armamentarium of medicine that we can give to our patients to help reduce their risk moving forward.
What is TAVR?
Yeah. So TAVR is the procedure that changed my life, I'll tell you, Steve. I mean, it stands for transcatheter aortic valve replacement.
Say it again.
Transcatheter aortic valve replacement.
Go ahead.
So transcatheter aortic valve replacement was originally designed as an alternative to an open heart surgical aortic valve replacement. And it was designed for patients who have aortic stenosis, which is thickening of the aortic valve. So it's the last valve of the heart, connects the pumping chamber to the rest of the body. In our elderly population, oftentimes the valve starts to get thickened and calcified and no longer opens as well as it's supposed to. So it creates, in essence, an obstruction to blood flow out of the heart. The standard therapy, which has been going on for 30 or 40 years now, is open heart surgery and cutting out the diseased valve and replacing it with a new valve. Transcatheter valve replacement is taking that valve, and instead of putting on a ring that gets sewn into place, it gets mounted on a metal cage that can be compressed, put through the artery in the groin with just a needle stick. The metal cage is then positioned to where your native valve is, and the metal cage is opened, pushing your valve out of the way, and inside the metal cage is the new functioning valve. So we're able to replace the valve with just a needle stick in the groin and no surgery of any kind. You know, in our program, I would say about 80 to 90% of people are then sent home the next day, and the recovery from this is extremely minimal. So we have patients who, you know, after a couple of days of being at home and just resting, they're back to their normal lives. And so it's compared to the recovery from open heart surgery, which, especially for our elderly population, you know, can be long and protracted. And so this has really become a godsend for that patient population. The beauty of the treatment was originally it was designed as kind of an alternative to patients who could not have open heart surgery. So they were very sick with other medical problems or very frail. You know, as the technology has advanced, you know, we've recently celebrated our 20th anniversary of the device. As the technology has advanced, it's now shown to be effective in almost everybody who has aortic stenosis. So even our healthier patients, we can now offer them this groundbreaking treatment. And so
TAVR, TAV, I'm sorry for interrupting. TAVR stands again for
catheter aortic valve replacement.
Wow.
So a surgical, they used to call a surgical aortic valve replacement, or SAVR, and now it stands for transcatheter aortic valve replacement. Yeah.
Dr. Hastings, thank you, because heart health is so incredibly important for all of us, whether there's a family history or not. Thank you for putting things in perspective. Appreciate it, doctor.
Yeah, no problem.
You got it. Stay with us. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by Fedway Associates, Inc., Delta Dental of New Jersey, the Healthcare Foundation of New Jersey, New Brunswick Development Corporation, the Port Authority of New York and New Jersey, Seton Hall University, the Russell Berrie Foundation, Investors Bank, and by the Adler Aphasia Center. Promotional support provided by New Jersey Monthly and by NJ.com.
This is the Seton Hall story, one that comes to life every day on our campus. This is the place where great minds discover, innovate, collaborate, and find their true calling. This is the place where passion has a purpose, where learning inspires leading. The bonds we make, the values we teach, inspire our community to take heart and take action. This is Seton Hall University. This is what great minds can do.